Hi, my name is Cami Corvino, and I will be doing an ear, nose, and throat exam on my patient.
I'm Bill Corvino, and I give consent for this video.
Okay, so first we're going to start with the ears, and I am going to start with inspection, and I will inspect the outside of his ears. And they look symmetrical, the color looks normal, there's no placky spots, the skin isn't peeling. Let me see. Yeah, so that looks good. Let me see. So I'm just going to kind of pull up on his pinna to test for any tenderness and press on his tragus. Does that hurt at all?
No.
Okay. And I'm going to look in his auditory meatus opening for any exudate, and there is nothing. It's nice and clear. I'm going to pretend that I have an otoscope, and I'm going to pull up and back on his pinna and to examine his ear canal. And hopefully I would be seeing his tympanic membrane, which would be flat and slightly pulled in and would have like a pearly gray shiny color to it. And also if I shine my light with the otoscope, I should see a cone-shaped light reflex. Okay, so that is the ears. Oh, also, I'm sorry. I am just going to do a little test to test your hearing, Bill.
All right.
Okay, so I want you to put your hand over, put your finger here and hold this ear. And I'm just going to come behind you and say a word. Bicycle.
Bicycle.
Okay, can you do it on the other ear?
I couldn't hear.
Sorry. Seesaw.
Seesaw.
Seesaw. Good. Okay. And I would, if I had a tuning fork, I would also do a tuning fork test to test for his hearing. And I would conduct a RIN test where I would test bone conduction, and I would tap the tuning fork and put it on the bone until he tells me when he stops hearing it. And then I would move the tuning fork around to the outside of the ear to test for ear conduction to see if he is still hearing it, and I would do that on both sides. And then I would do the Weber test where I would put the tuning fork on top of his head, and hopefully he would tell me that he hears it in both ears equally. Next, I will inspect his nose, and I'm just looking straight at his nose. It is in proportion to the rest of his face. It is not symmetrical. It deviates to the right on the outside. I'm just gonna look with my light inside of his nose to look at his mucous membranes. I'm just going to look, Bill. And they look nice and pink. Of course, I could see better if I had an otoscope. So it looks nice and pink. There's good moisture inside of his nose. There's no discharge. And then I'm going to just palpate his sinuses to check for any pain when I press. For any pain?
No.
And then I check his sinuses here. Any pain?
No.
Okay. So next I'm going to inspect his mouth, and I'm looking at his mouth. His lips are nice symmetrical. Can you open your mouth for me, please? Okay, I'm looking at his tongue. His tongue is nice and pink. There's a little bit of a white coating on it and a fissure down the middle of his tongue. I'm gonna take my tongue depressor and, well, first I'm just gonna pull, you can keep your tongue in. I'm just gonna pull down his lip. Look at his mucosa, it's nice and pink. And look the inside. Open your mouth, please. I'm just going to check inside here. There's buccal cavity, and that is nice and pink and moist. And can you put your tongue up for me, please? Look at both sides of his tongue, and I don't see any white patches or anything concerning. Okay, you can put your tongue down and just say, his uvula is midline. His tonsils are not swollen at all. There's no white patches. And if you could just stick your tongue out for me. And his tongue comes out to midline. It doesn't deviate to one side or the other when he sticks his tongue out. Okay. And that checks, when I stick his tongue out, that checks to make sure that one of his cranial nerves is working. And that would conclude our exam for ear, nose, and throat. Thank you very much.